Tuberculosis. Key facts. A total of 1.25 million people died from tuberculosis or TB in the year 2023, which includes 161,000 people with HIV. Worldwide, has probably returned to being the world's leading cause of death from a single infectious agent, following 3 years in which it was replaced by coronavirus, that is COVID-19. It was also the leading killer of people with HIV and a major cause of deaths related to antimicrobial resistance. In 2023, an estimated 10.8 million people fell ill with TB worldwide, including 6 million men and 3.6 million women and 1.3 million children. TB is present in all countries and age groups. TB is curable and preventable. Multi-drug resistant TB, that is MDR-TB, remains a public health crisis and a health security threat. Only about 2 in 5 people with drug-resistant TB access treatment in the year 2023. Global efforts to combat TB have saved an estimated 79 million lives since the year 2000. US $22 billion is needed annually for TB prevention, diagnosis, treatment, and care to achieve the global target by 2027 agreed at the 2023 UN High Level Meeting on TB. Ending the TB epidemic by 2030 is among the health targets of the United Nations Sustainable Development Goals. Overview. Tuberculosis or TB is an infectious disease caused by bacteria that most often affects the lung. It spreads through the air when people with TB cough, sneeze, or spit. Tuberculosis is preventable and curable. About a quarter of the global population is estimated to have been infected with TB bacteria. About 5 to 10% of the people infected with TB will eventually get symptoms and develop TB disease. Those who are infected but free of disease cannot transmit it. TB disease is usually treated with antibiotics and can be fatal without treatment. In certain countries, the bacillus calmette urine BCG vaccine is given to babies or small children to prevent TB. The vaccine prevents deaths from TB and protects children from serious forms of TB. Certain conditions can increase a person's risk for TB disease, like diabetes, high blood sugar, weakened immune system, that is, for example, from HIV or AIDS, being malnourished, tobacco use, harmful use of alcohol. Symptoms. People with TB infection don't feel sick and aren't contagious. Only a small proportion of people who get infected with TB will get TB disease and symptoms. Babies and children are at a higher risk. TB disease occurs when bacteria multiply in the body and affect different organs. TB symptoms may be mild for many months, so it is easy to spread TB to others without knowing it. Some people with TB disease do not have any symptoms. The common symptoms of TB are prolonged cough, that is sometimes with blood, chest pain, weakness, fatigue, weight loss, fever, night sweats. The symptoms people get depend on which part of the body is affected by TB. While TB usually affects the lung, it can also involve the kidneys, brain, spine, and skin. Prevention. Follow these steps to help prevent tuberculosis infection and spread. Seek medical attention if you have symptoms like prolonged cough, fever, and unexplained weight loss, as early treatment for TB can help stop the spread of disease and improve your chances of recovery. Get tested for TB if you are at increased risk, such as if you have HIV or are in contact with people who have TB in your household or workplace. TB preventive treatment or TPT prevents infection from becoming disease. If prescribed TPT, complete the full course. If you have TB, practice good hygiene while coughing, including avoiding contact with other people and wearing a mask, covering your mouth and nose when coughing or sneezing, and disposing of sputum and used tissues properly. Special measures like respirators and ventilation are important to reduce infection in healthcare facilities and other institutions. Diagnosis. WHO recommends the use of rapid molecular diagnostic tests as the initial diagnostic test in all persons with signs and symptoms of TB. Rapid diagnostic tests recommended by WHO include the expert MTV, RAF, Ultra, and TrueNat assays. These tests have high diagnostic accuracy and will lead to major improvements in the early detection of TB and drug-resistant TB. A tuberculin skin test TST interferon gamma release assay, that is IgRA, or newer antigen-based skin test TBST can be used to identify people with infection. Diagnosing multi-drug resistant and other resistant forms of TB, like see multi-drug resistant TB sections below, as well as HIV-associated TB, can be complex and expensive. Tuberculosis is particularly difficult to diagnose in children. Treatment. Tuberculosis treatment is treated with special antibiotics. Treatment is recommended for both TB infection and disease. The most common antibiotics used are isoniazid, rifampicin, pyrazinamide, and ethambutol. To be effective, medications need to be taken daily for 4 to 6 months. It is dangerous to stop the medications early or without medical advice as it can prompt TB bacteria in the body to become resistant to the drugs. TB that doesn't respond to standard drugs is called drug resistant TB and requires treatment with different medicines. Multi-drug resistant TB or MDR-TB. Drug resistance emerges when TB medicines are used inappropriately through incorrect prescription by healthcare providers, poor quality drugs, or patients stopping treatment prematurely. MDR-TB is a form of TB caused by bacteria that do not respond to isoniazid and rifampicin, the two most effective first-line TB drugs. MDR-TB is treatable and curable by using other drugs which tend to be more expensive and toxic. In some cases, extensively drug-resistant TB or XDR-TB can develop. TB caused by bacteria that do not respond to the most effective drugs in MDR-TB treatment regimens can leave patients with very limited treatment options. MDR-TB remains a public health crisis and a health security threat. Only about 2 in 5 people with multi-drug resistant TB access treatment in 2023. In accordance with WHO guidelines, the detection of MDR-TB requires bacteriological confirmation of TB and testing for drug resistance using rapid molecular tests or culture methods. In 2022, new WHO guidelines prioritized the short 6-month all oral regimen known as BPALMP or BPAL as a treatment of choice for eligible patients. Globally, in 2023, 5,646 people with MDR or RRTB were reported to have been started treatment on BPALM or BPAL regimens, up from 1,744 in 2022. The shorter duration, lower pill burden, and high efficacy of this novel regimen can help ease the burden on health systems and save precious resources to further expand the diagnosis, stick, and treatment coverage for all individuals in need. The past TB treatment used to last for at least 9 months and up to 20 months. WHO recommends expanded access to all oral regimens. TB and HIV. People living with TB are 16 or times more likely to fall ill with TB diseases than people without TB. Can be an uncertainty interval of 14 to 18 times is stated. TB is the leading cause of death among people with HIV. HIV and TB form a lethal combination, each speeding the other's progress. In 2023, about 161,000 people died of HIV-associated TB. The percentage of notified TB patients who had a documented HIV test result in 2023 was 80%. This was the same level as in the year 2022, but up from 76% in 2021. The WHO African region has the highest burden of HIV-associated TB. Overall, in 2023, only 56% of TB patients known to be living with HIV were on antiretroviral therapy or ART. WHO recommends a 12-component approach of collaborative TB HIV activities, including actions for prevention and treatment of infection and disease to reduce the deaths. Coming to the impact. TB mostly affects adults in their most productive years. However, all age groups are at risk. Over 80% of cases and deaths are in low and middle income countries. TB occurs in every part of the world. In 2023, the largest number of new TB cases occurred in the WHO Southeast Asia region, which accounts for 45%, followed by the African region 24%, and Western Pacific region 17%. Around 87% of all new TB cases occurred in 30 high TB burden countries, with more than two-thirds of the global total in Bangladesh, China, Democratic Republic of Congo, India, Indonesia, Nigeria, Pakistan, and the Philippines. Globally, about 50% of people treated for TB and their households face total costs, that is, direct medical expenditures, non medical expenditures, and indirect costs such as income loss that are catastrophic. That is, more than 20% of total household income. Far from the WHO NTB strategy target of zero, those with compromised immune systems, such as people living with HIV, undernutrition, or diabetes, or people who use tobacco, have a higher risk of falling ill. Globally, in 2023, there were estimated 0.96 million new TB cases that were attributable to undernutrition, 0.75 million to alcohol use disorder, 0.70 million to smoking, 0.61 million to HIV infection, and zero point 0.3 million to diabetes. Investments to end TB. US dollar 22 billion are needed annually for TB prevention, diagnosis, treatment, and care to achieve global targets by 2027, agreed at the 2023 UN high-level TB meeting. As in the past decade, most of the spending on TB services in 2023, which accounts for 80%, was from domestic sources. In low and middle income countries, international donor funding remains crucial. From 2019 to 2023, there was a decline of US dollar 1.2 billion in available funding from domestic sources and a very slight increase of US dollar zero point 0.1 billion in funding provided by international donors. Most of the reduction in domestic funding is largely explained by reductions in domestic funding trends in Brazil, the Russian Federation, India, China, and South Africa BRICS. Financing for TB research and innovation at US dollar 1 billion in 2022 also continues to fall far short of the global target of US dollar 5 billion per year, constrained by the overall level of investment. The WHO response. WHO is working closely with countries, partners, and civil society in scaling up the TB response. Six core functions are being pursued by WHO to contribute to achieving the targets of the 2023 UN high-level meeting, political declaration, sustainable development goals, NTB strategy, and WHO strategic priorities, providing global leadership to NTB through strategic development, political and multi-sectoral engagement, strengthening review and accountability, advocacy and partnership, including with civil society, shaping the TB research and innovation agenda, and simulating the generation, translation, and dissemination of knowledge, setting norms and standards on TB prevention and care, and promoting and facilitating their implementation. Developing and promoting ethical and evidence based policy options for TB prevention and care, ensuring the provision of specialized technical support to member states and partners jointly with WHO regional and country offices, catalyzing change and building sustainable capacity, and monitoring and reporting on the status of TB epidemic and progress in financing and implementation of the response at global, regional, and country levels.